Hello, everyone. Welcome to day 3 of the Preemie Health Talks. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Health Talks is the first international live series that CPBF is hosting in 2021. These educational sessions are in collaboration with the Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, the Canadian Neonatal Network, the European Foundation for the Care of Newborn Infants, EFCNI, and GLANCE, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to empower families of premature babies every step of the way through support and education. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their babies. For this Preemie Health Talks, we brought health experts from around the world and all over Canada. We have been diving deep into topics affecting preemie health, from breastfeeding to parental mental health during the pandemic, from the importance of kangaroo care and best practices to protect your baby's skin. If you need closed captioning, you can watch it live from our YouTube channel and enable closed captioning on the screen. I want to thank our sponsors, Medela, Water Wipes, and Prolacta Bioscience for their ongoing support. Please use the comment area below your screen to ask questions, to share your perspective and stories. Today we have 2 presentations. The first one by Dr. Johanna Kostenzer on the global impact of COVID-19 on neonatal care from the parent's perspective. And also, we're going to have Dr. Pablo Duran talk about early nutrition and the impact on the life course. And right here, we're going to start with Dr. Johanna Kostenzer on the global impact of COVID-19. And let me just bring her to our screen. Here you go. Hello. So this is the global impact of COVID-19 on neonatal care, the parents' perceptions. The COVID-19 pandemic has created exceptional challenges, especially for the care of the most vulnerable groups of patients, such as sick and preterm-born children in need of special or intensive care. In the course of the pandemic, several measures were taken to reduce social interaction and the risk for transmission, but especially also in hospitals and neonatal intensive care units. Restrictive measures were implemented. This talk will focus on the impact of the COVID-19 pandemic on special and intensive care for newborns by discussing recent results of a global study exploring parents' experiences during the pandemic. And joining me live from Munich, Germany, Dr. Johanna Kostenzer, who is the head of scientific affairs at the European Foundation for the Care of Newborn Infants, EFCNI. Her current projects focus on the impact of COVID-19 on neonatal care and on the need for regulation of donated human milk in the European Union. With her academic expertise in the field of reproductive health and health governance, Johanna supports EFCNI's mission to pave the way for the best start in life. Dr. Kostenzer, thank you so much for joining us here today.
Thank you so much, Fabiana, for inviting me. I'm very happy to be speaking here today on behalf of EFCNI and on this particular topic.
That is great. So I will let you share your screen. So I know you have a presentation to share with us. And for all of you watching us live from Facebook or YouTube, please send your questions and your comments that we're going to be addressing right after her presentation. And here you are. The screen is yours.
Yes. Again, thank you so much, Fabiana, for inviting me. I'm very happy to be speaking here today at the Preemie Health Talks. And I will speak on behalf of the European Foundation for the Care of Newborn Infants, which is the first European organization to represent the interests of preterm infants and their families. And by the initiative of EFCNI, the Global Alliance for Newborn Care, we started a survey and a study on the global impact of COVID-19 on neonatal care and explored the parents' perceptions in this particular context. And of course, today I will talk about this survey and also will actually for the first time also tell you a bit more about the results of this study that we have conducted. So I will briefly guide you through the next few minutes and the next few, well, half an hour probably. So I will first, of course, explain a bit more about about the background of the study that we conducted, and then go into more detail of the findings of our study. And we'll focus here on different pillars of infant and family-centered developmental care. And in the end, of course, I will also give you some conclusions and a take-home message for this talk. So first, what I would like to share with you is a global overview of preterm birth in all different countries that you see here on this map by the World Health Organization. So to say it in general, preterm birth and preterm birth related complications are the leading cause of death for children under 5 years of age. So this, of course, is a very major factor and a very important field of care that needs to be taken care of. And together with infants that are sick or that are born at a low birth weight, this group is a very vulnerable group of patients that requires special attention, special treatment, and is, of course, also a difficult patient group in that sense, as it is such a vulnerable group and also the youngest group of patients in general. So what we now saw in the last year was that there was, because of the COVID-19 pandemic, a strong impact on, all different industries and sectors, of course, but also in particular on the healthcare sector. So this pandemic created severe challenges for different aspects of the healthcare sector. However, also particularly on neonatal care and on the care for these very vulnerable and these very young infants that require special or intensive care. And what we saw because of this pandemic and also related restrictions that were implemented because of the pandemic was that many hospitals and healthcare organizations implemented separation policies during this COVID-19 pandemic. So that means that worldwide, many neonatal units have adopted separation policies, which means that they limited or even prohibited access of parents to neonatal care units. So this means that parents were not able to be present with their newborn in the neonatal care units. What we also know from research is that separation can result in long-term health and developmental issues in newborns and can also impact the mental health of the parents. So the separation does not only have an impact on the development for the infant or infants themselves, but it also has negative impacts for the parents and the family as a whole. What we also know from very recent research is, however, that the survival benefit of kangaroo mother care, and kangaroo mother care is this very close skin-to-skin contact, far outweighs the relatively small risk of death due to the COVID-19 infection. And here, of course, I need to put this in context because small risk of death due to COVID can also be misunderstood. But what we mean here is that this is a small risk of transmission from the parents to the infants in the neonatal intensive care units. So this risk is very, very small, and prohibiting access or prohibiting kangaroo mother care is out of context in this regard and is disproportionate when we consider the relatively small risk of transmission and then also death due to the COVID-19 infection. So these are all facts, but what we also know is that many parent organizations that we are in contact with and that are in our network have had very severe experiences with regards to the involvement of parents in the care of their preterm, sick, or low birth weight infants. So here I really have to mention that ever since the pandemic started, and particularly started also in Europe, so from early 2020 onwards, we had regular meetings with parent organizations, so of course digital meetings. And in those meetings, the parents told us what the situation was like in their countries. And they told us that parents were separated from their infants so that the parents could no longer be present with the infants in the neonatal units. But also there were other effects in terms of that the partner, for example, could not accompany the mother or the to-be mother-to-be when going to prenatal care appointments and so on. So there were very strong policies all of a sudden in place. And of course, we knew, okay, this is anecdotal evidence. So these are stories from parents that are being told, but we really need hard facts in order to know what's happening and what's going on. And that was actually also our our incentive and impulse to dig a little deeper and to explore the parents' perceptions and the parents' experiences with regards to the implemented measures due to COVID and the coronavirus. So this led finally to the study that I will now be presenting. So the title of the project, so to say, is Impact of Coronavirus COVID-19 on Special Intensive Care for Newborns, a Parent's Perspective. So what we did with the study was to explore parents' experiences related to all these challenges that were caused by the pandemic and actually by the pandemic-related restrictions that were put in place in neonatal care. And we did this with a global and multilingual online survey. So we set up an online survey that was later also translated into 23 different languages, because we really aimed for a global outreach and an outreach in many or as many countries as possible. And I also have to say a big thank you at this point to all the parent organizations all across the world who helped us translating this survey into so many different languages. In the end, the participants of our survey were actual parents of sick or preterm born infants who were born in this timely context of the COVID-19 pandemic. And here we focused on this first year of the pandemic. So that means that we asked parents of children who were born between the 1st of December 2019 until the 30th of November 2020. So that was also the point when our data collection ended. We did not do the study completely on our own, so we also had a few collaborating organizations who supported, for example, also the setup of the survey and gave feedback on the survey and the questionnaire. And these collaborators were, on the one hand, COIN, so the Council of International Neonatal Nurses, ESPR, which is the European Society for Pediatric Research. Also, the NIDCAP Federation International supported our project, and finally also UNPS, which is the Union of Neonatal and Perinatal Societies. So those 4 collaborating organizations, together with many parent organizations, helped us in the setup and also in the dissemination of the online survey. I also need to mention at this point that we received an earmarked donation by Novartis in support of this study. However, Novartis did not have any kind of influence on the study. It was simply an independent donation, and we at EFCNI, and in particular the scientific department, completely independently worked on this survey. To give you a short intro into the questionnaire itself, so what kind of questions did we actually ask? So, of course, on the one hand, we asked for COVID-19 related questions. So, of course, for example, if there was an infection and other questions in that field. We also asked questions in the field of prenatal care. So, for example, if appointments took place on a regular basis or if there was some sort of changes due to the COVID restrictions. We also looked into the topic of breastfeeding and nutrition. We asked questions with regards to parental presence. We also asked questions with regards to communication, and here in particular with regards to health communication. And also we focused on the topic of mental health and support. And all these questions and topic areas are part of infant and family-centered developmental care. So this was also the overall concept that we used for the setup of our questionnaire and for the setup of the survey in the end. The participants who could then finally take part in the survey were, as I already mentioned, the child of the parents had to be born on 1st of December 2019 or later. We chose the 1st of December because this was also the date or the approximate date when the first COVID case was identified. And also the baby of the parents had to be receiving special or intensive care. So we really exclusively focused on infants that were either born preterm, of lower birth weight, or that were sick and that needed this special care. And also the respondents had to be the parents of the baby. So we really exclusively wanted to look into the parents' experiences with regards to neonatal care. Finally, in total, we had more than 2,100 respondents from 56 countries all across the globe, who were then finally also included in our analysis. And on the next slide, I would like to give you a short insight into what the country overview looks like. I apologize for the graph. It's not very sharp, but I hope you can still see the most important things, which are simply that there is, of course, strong variation across the countries in terms of the response. So what we see immediately is that one country, and as we see here, Turkey, has more. Here we had more than 300 participants, and also in some other countries we had more than 100 participants. For example, in France, in the Netherlands, in Poland, but also in the Ukraine. And in some other countries, or many other countries, we had between 30 to 50 respondents, and so there's of course a strong variation, I would say. But overall, as I said, we have more than 2,100 respondents from many different countries, and we're actually very happy with this response because we also need to consider the very sensitive target group that we have for this study, because it's not only parents of newborns, but it's parents of very vulnerable newborns, and probably participating in a study is not their priority number one. So we also need to keep that in mind, and are very happy for every parent who took the time to take part in our survey. Yes, but now is actually the time that I would like to share some of the results, and some of the very first results of our study. Because here I also need to mention that our study has not been published yet. So we're at the moment finalizing the first manuscript, and it's in internal review, and will soon be submitted, and hopefully then also soon be published. But also just keep this in mind that it's still unpublished findings that I'm going to share. What I will share with you now is some findings from 4 different pillars of this infant and family-centered developmental care. So I will focus in particular on parental presence, on kangaroo mother care and skin-to-skin care, on the topic of breastfeeding, and on mental health and support. In our study and survey, we of course also focused on different topics and different areas, which are in the end all interlinked. But for this presentation and this talk, I chose those 4 because the results might be of great interest also to the audience. So starting with the first one, I will first always show an infographic with some more general information and some scientific evidence before I will then also go into more detail about the findings of our study. So looking first into parental presence. So parental presence means the presence of the parents with the newborn or with the preterm infant in particular, in general, but also then in the neonatal intensive care unit. So parental presence, as you can imagine, and as you probably know, has a lot of benefits for the development of the infant and also for the family and family bonding as a whole. Many studies show, and in particular this one meta-analysis shows, that single family rooms, for example, decrease the risk of sepsis by 37% and also increase breastfeeding rates at the time of discharge by 31%. Furthermore, in neonatal wards, where the mothers were not able to be with their baby on a daily basis, 29% of these children had behavioral problems at the age of 7 to 8 versus 0% if mothers were present every day. So this also shows that the presence of the mother, but also of the parents in general, has very strong benefits for the development of the infant. And finally, also, parent empowerment in the NICU decreases parental stress, depression, and anxiety, and leads to shorter NICU and hospital stays, and consequently decreases also the costs to society. So what we learn from these facts is that, of course, parental presence has a strong benefit for the infant, and especially for the vulnerable infant in terms of development, but also it has a lot of benefits for the families and the parents in particular, also with regards to mental health. But what did we now find in our study? So here I would like to share a few results and a few messages from our study and our findings. One is that approximately half of the respondents from our study were not allowed to have another person present with them during birth. So that was like the first part that we looked at, what happened during birth. And here, almost half was not allowed to have someone else with them. So that also means that they were alone, the mothers were alone. I have to mention at this point also that in some countries, this has also, of course, been the case before the COVID pandemic, especially when we look at C-sections, then it's often the case that the mother is alone. So this is also one limitation of our study, that we cannot really compare before COVID and during COVID. But I still wanted to show this because, 50% is, of course, a lot. What is, however, also very interesting is that 70% of our respondents stated that the mother was allowed to be present with the baby, and 56% of the fathers or the partners were allowed to be present with the baby. And on first sight, of course, what we see is, 70% and 56%, that's actually quite a lot. But we, of course, need to look at this from the other side. That also means that 30% of the mothers were not allowed to be present with the baby that was receiving special or intensive care. And also 44% of the fathers were not allowed to be present. These are, of course, shocking results. And what is even more shocking is when we see it like this, because in the end, in one out of five cases, nobody was allowed to be present with the baby. So that means the baby was alone in the neonatal intensive care unit, and alone, of course, meaning without the family, without the parents. So also no other family members was allowed to be there. What we also found, that while 40% of the respondents had unlimited access, so that means that they could be there all the time, or there were no restrictions, 30% were only permitted to be with the baby for up to 1 hour per day. And finally, half of the participants were not offered any alternatives to being present with their baby. So this is in many cases actually quite common, to at least then provide photos or videos or live stream, or at least phone calls. But in half of the cases, there was no alternative to being present with the baby. I would now like to focus on the next topic, which is kangaroo mother care and skin-to-skin care. And also here, there is a lot of scientific evidence for the benefits of kangaroo mother care and skin-to-skin. So of course, a very close contact with the mother has strong benefits for the development of the preterm, low birth weight or sick infant. On the one hand, kangaroo mother care, for example, reduces the mortality by 40%. It also reduces infection and sepsis by 65% and hypothermia by 72%. So the benefits in that regard are, I would say, very clear. Kangaroo mother care, furthermore, has significant, long-lasting social and behavioral protective effects on a preterm baby, even on a long-term basis. And also, skin-to-skin contact with the mother and the baby enhances the general stability of the child, resulting in less stress, better sleep, and cognitive control across the first 10 years of life. So in general also, skin-to-skin care decreases the cortisol level in mother and baby. It also reduces parental stress, depression, and supports breastfeeding. So as we see from this infographic, is that skin-to-skin care, which also includes kangaroo mother care, has many, many benefits for the development of the child, but also for the family bonding, and also reduces stress among the parents. So again, what did we find with our study? What we found that almost 80% of the respondents were allowed to touch their baby in the incubator or at the bed, and half of them as often as desired. And again, here we see 80%, that's really a high number. So the first impression would be, that's really good actually. But again, we also need to see it from the other side, which means that in 20% of the cases, the parents were not allowed to touch their baby in the incubator or in the bed. And this, as we learn also from the facts, it has strong negative effects then also for the development of the baby, but also for the parental bonding with the child. What we also found that in more than 50% of the study participants and the cases, they stated that skin-to-skin contact was initiated after the first week, after discharge, or not at all at the time of data collection. So that also means that in the other 50%, it was initiated before the first week or during the first day even, but in many cases it took quite a while until skin-to-skin contact was actually initiated. What we then also learned from the study is then in approximately 1/3 of the participants was allowed to have skin-to-skin contact as often as they wanted. So 1/3 was really on the, as much as you can say, good side of life in that regard. However, also on the other side, 2/3 of the participants were not allowed to have skin-to-skin contact as often as they wanted. Looking into breastfeeding, I think here it's, of course, the benefits of breastfeeding are, of course, quite obvious. And I think I don't need to go into too much detail here, because the benefits of, in particular, exclusive breastfeeding for the first months of life have not only been confirmed by the World Health Organization, but also by many, many organizations and healthcare professionals. And the benefits are actually undisputed. What I would like to mention at this point, however, is that we, of course, need to be aware that breastfeeding is not always possible. So even though it is the gold standard, in particular for preterm infants or also sick and low birth weight infants, breastfeeding is sometimes not possible because the infants are not yet able to be breastfed, or also on the other hand, because the mother is not able to breastfeed because lactation has not started yet, or for many other reasons. And of course, also there are sometimes cases where the mother does not want to breastfeed for other reasons, which also needs to be respected. However, of course, breastfeeding and human milk and mother's own milk, so to say, has a lot of benefits. It decreases infant mortality, but it also decreases the risk for necrotizing enterocolitis, sepsis, or infant mortality, and is therefore very important for the development of the child and also for the mental health outcome and movement development of a baby. What we found in our study was that in general, breastfeeding was supported quite well also during the COVID-19 pandemic. So in more than 85% of the respondents, the infants were partly or exclusively breastfed or fed with their mother's own milk, which is either expressed or pumped milk, in the first weeks. We also found that the initiation of breastfeeding and the provision of mother's own milk took place mostly on the first day or during the first week after birth. And over 70% of the respondents were allowed to bring expressed milk. However, here I need to mention that this was not the case to the same extent in countries where quarantine was in place. So here we really see a difference between the level of restrictions within the respective countries. So the more restrictive the measures were, in terms of the more restrictive the policies were, for example, like quarantine or a lockdown, also, there were more restrictions on, for example, the bringing expressed milk to the neonatal intensive care unit. As a last topic that I would like to highlight here is I would like to explore a bit more on mental health and support. And here I unfortunately do not have an infographic, but as you can imagine, mental health and also support for the parents is also a very important topic and a very important field. Because what we do have is we have new parents, so parents of a newborn. And in general, of course, this is already a stressful and a life-changing event. But if we now consider also parents of infants who need special or intensive care, who are born preterm, who are sick or at low birth weight, these parents are under immense stress and pressure, also because they need to be at the hospital a lot and so on. And then also seeing this in the context of COVID-19, there is, of course, a big pressure on the parents. What we found that in almost 80% of all respondents worried to a high degree or to some degree about the COVID-19 situation during pregnancy and after birth. The respondents of our study worried the most when more restrictive measures were in place. So again, as we had it before with the breastfeeding topic, also here, the level of restrictions plays a role with regards to the mental health status of the parents. Half of the parents or the respondents that we have included in our study did not feel adequately informed and mentioned that there was no mental health support. And this support includes counseling, it includes self-help group or patient groups, and half is really, it's like 50%, which is also quite a lot. And it also means that there was really a lack of support for these parents. And finally, adequate information on COVID-19 protective measures was lacking when the parents or when the infant was discharged from the hospital. And that was for 40% of the respondents mentioned this. And here at this point, what I also need to mention is that, again, I of course need to put it in context, because the COVID-19 situation, and especially at the beginning of the pandemic, was of course a new situation for everyone involved. So that also means the healthcare professionals did also not have sufficient or adequate information. So of course they then could also not pass it on. However, what is really important to mention here is that we still need to be better prepared for future pandemics and for future emergency situations like this, so that we can then in the end also provide better care and also provide better support for the parents in general. But this actually already brings me to the end of my presentation, or to the final part of my presentation, with some concluding remarks and some summarizing remarks. Because what I would like to end this presentation with is a call for zero separation. And zero separation means that parents should not be separated from their newborns, because it creates more harm than actual benefit. So the COVID-19 related restrictions in neonatal intensive care units really severely challenged all the evidence-based cornerstones of infant and family-centered developmental care, such as, for example, separating parents and their newborn child, but also, as I mentioned before, also has impact on breastfeeding patterns. It has an impact on kangaroo mother care and skin-to-skin care, and also on mental health. So what we therefore call for is a zero separation policy, and also an immediate, sensible and compassionate lifting of existing restrictive visitation policies in the hospital settings, and in particular in the neonatal intensive care units. What we need to do is plan for the ongoing COVID-19 pandemic, but also we need to be ready for future pandemics and emergency situations. And the findings that we have from this survey must be considered by public health experts, but also by policymakers alike, to reduce unnecessary suffering and deaths. And here I would like to thank you again, Fabiana, for inviting me, and also to the audience for listening. And in case you have any questions with regards to the study, then feel of course free to reach out, or also of course to ask your questions now in the Q&A session. Thank you so much.
Thank you, Dr. Kostentzer. What a great presentation. You can stop sharing your screen so you can, yes, that's better. So thank you so much for shining the light on the situation worldwide in the NICUs. And it's heartbreaking that over a year later, we are still talking about this, and the restrictions still remain in a lot of hospitals. I think my first question to you is, did you see any variation between countries that are like developing countries? What have you seen in terms of variations by country, or even in different areas of the countries?
Mm-hmm. Yes, we do indeed see big differences. So what we did with our analysis was, at the first, we looked more into, are there any differences with regards to the level of restrictions? Because in some countries we had more severe restrictions during the first year of the pandemic, and in others we had very strong restrictions. So that's one difference we looked at. And now at the moment we're also working on a second study, or a second analysis of the data, where we really look into country-specific differences. And here we also see strong variation across some countries. So, for example, in Australia or in New Zealand, what we see is that parents have not been separated from their newborn. So the policies were actually the same than before the COVID-19 pandemic, because this was apparently also a priority by the healthcare system, or by the health policy, to keep parents and the infants together and keep them close. However, in other countries, we see strong interference into this parental presence. So as, for example, in China, parents were not allowed to be present with their infant. So there was simply there was a lockdown in all different aspects, also in neonatal care. And of course, this, as we know from the research, and not only from our research, but in general from science, is that this separation has a very strong impact and a negative impact on the development of the child. So this is really, also the reason why we call for this zero separation policy, because it creates more harm than benefit in the end. And so there is strong variation across countries.
Absolutely. Even here in Canada, we have variations in hospitals where even across the street from each other. And we have hospitals who never change the policy in terms of both parents being present, to hospitals that until today has a 3-hour limit for parents to stay with the baby, which is, okay, that's a year later. We have more evidence. We have enough PPE and, protocols in place to keep the parents and babies together. But I just want to bring our audience. I want to thank Joanne from UK from joining us here today. She's saying hello on behalf of Noah Star. We have Shakira. Thank you for your talk. And Inaya from Pakistan. Hello. Thank you so much, all of you, for joining us here today. If you have any questions or comments, please use the comment box below. So we have one more question here. Let me just take this out of the screen. What was the average length of hospital stay? Will they be able to show the longer in hospital or sicker the baby that could have an impact on their results on all your pillars?
Yeah, so we looked, or we will also look more into this. However, we did not make an analysis according to the length of stay of the infants. Also, because the data collection was, of course, one moment in time. So we also had parents or also infants of different stages of their hospitalization. So for some parents who answered the survey, the child was just born 1 week ago. And for the others, it was already in the past, so the discharge already happened. So we do have quite of a variation here, and we have so far not analyzed it according to hospital, because it's also it's probably a bit difficult to make. What we also need to consider here is a global study is of course great, but it also has some limitations because we did collect the data in many different countries at the same time. It was not possible to allocate for the differences in the pandemic. So of course, as we now know, the pandemic several waves throughout the last year, but we could not accommodate that in our analysis, because it was simply impossible to look into every country to see what kind of waves of the pandemic took place, and to what degree also that was really difficult to follow. And that's of course a limitation. Still, what we have with this global study, very good impression of the restrictions that took place, and also we can then draw conclusions for policymakers and healthcare professionals alike.
Okay, so we have actually two people asking here, how can you get a copy of the study once it has been published? Thank you, Joanne, for asking that. And I think same question from Sherry, how can we find out when this will be published?
Yes, so we will submit the study very soon and hope that it will also be published very soon, and we will also have a second paper out as well. And yes, thank you also for sharing the link to EFCNI. So what you can do for sure is to sign up to our newsletter, because of course the results will be promoted in our newsletter. And what is also very important for us is that we will have the publications as an open access. So that's for us very important to have the data out for everyone, because that's also our, I would say, responsibility in that regard. Because we only started with this survey because we were so inspired and also driven by the parents' experiences. So we then decided, okay, if we write this manuscript and have a scientific publication, we cannot have this in some library and hidden only for scientists, so to say, but this has to be public information. And this is also why we decided this needs to be accessed and available for everyone. So this is also why we will have papers published in open access in scientific journals. However, in addition, what we're planning for is a full report, including all the data for every country, which will then be available also on our website, and which is then for download for free for everyone who is interested and who is willing also to look into the information and documents, and we then also plan further activities around that, but that will only happen a bit later in the year. But yeah, as I said, just feel free to sign up our newsletter and you will stay informed, and you will be able to access all the data and information on this study.
Absolutely. I'm just sharing the link again, but I highly recommend everyone to follow EFCNI or Glance's social media channels, where they post a lot of information there. And also, we always amplify here at CPBF with the message from EFCNI, especially when this publication comes out. We're certainly going to be sharing. Let me see if there is one more. Sherry said, thank you for advocating for parents and their children. So let's talk a little bit about the Zero Separation campaign before you wrap it up, because the Zero Separation campaign was launched in July last year, right at the beginning of the pandemic, when a lot of us parent organizations started having meetings constantly with FCNI, and we saw the restrictions in our own countries, and we decided to put this call to action together. So what has been the impact of the Zero Separation campaign so far?
Yeah, well, the Zero Separation campaign, as you already mentioned, was initiated last year, and it will also be continued for the next year, because we also see that the pandemic, even though we have vaccinations available now, it will not be over very soon. So we'll keep on focusing on the Zero Separation campaign. And what we see is that there is very strong interest in this campaign, and we get a lot of requests, not only from parent organizations who of course also share this mission and this interest, but also from healthcare professionals, from policymakers, from many different groups, also the media of course, who have an interest in this and who also feel with the parents in terms of the Zero Separation policy or the call for action, so to say. So there is great interest, and it has already been picked up by many organizations and people to support this message. And we of course invite everyone to spread the message, to spread and use the hashtag, because this is really at our heart at the moment, because Zero Separation, and we need to really be aware of this, this is not only a matter of COVID-19. Zero Separation has been an issue before the pandemic, and it will unfortunately also be an issue after the pandemic, because very often in many cases, in many countries and regions of the world, it's of course, or not of course, it is unfortunately a measure to separate the parents from the infant for a variety of reasons, because I don't know, perhaps the treatment is then easier, and so to say, or it's just the local policy. However, what we know from scientific evidence is that this is not good for the development of the child, and it even has negative consequences. So the Zero Separation policy is for us, EFCI, and for GLANCE, of course, it's not only related to COVID-19, and that's really a strong message I also need to bring across here, because it's also an issue pre and post pandemic. So
absolutely. Dr. Costa, sir, thank you so much for joining us here today to share your knowledge, what you've learned for the last year during the pandemic. And certainly we have to continue to do this advocacy work because, as you said, this is beyond the pandemic. We need to keep parents and babies together. We have enough evidence in all the pillars that you mentioned that the parents are essential caregivers and then ICU for the babies, and you can never be seen as visitors. So I really appreciate the time that you took today to join us here. I know in Germany it's almost 8 o'clock right now. So I really appreciate your time today. Thank you.
Thank you so much. Thank you.
And for all of you watching us here today live on Facebook and YouTube channel, thank you so much for your participation, for your time to be here with us today. We'll be back in just a few minutes with Dr. Pablo Duran, talk about breastfeeding, nutrition, and the impact on the life course. I want to also thank our sponsors, Medela Water Wipes and Prolacta Bioscience, for their ongoing support. And CPBF is a registered charity, and 100% of all donations received this week will go to our support programs for families. To donate, please go to canadianpremise.org and stay tuned, and we'll be back in just a few minutes.